Hello, and welcome to Team Insurance's presentation on HIPAA compliance in the insurance industry. My name is Bridget Thompson, and I will be your narrator for this presentation. Healthcare compliance programs are extremely important in order to ensure any healthcare organization runs smoothly, efficiently, and effectively. Without a compliance program, there is a ton of room for error and manipulation to occur, drastically damaging the company's operations and reputation. One of the most important acts, if not the foundation, that helps to contribute to compliance programs includes HIPAA, the Health Insurance Portability and Accountability Act of 1996. This act provides United States legislation that provides data privacy and security provisions for safeguarding medical information. The case that is going to be described during the presentation to demonstrate how important it is to have an effective compliance program is the S Corporation versus the U.S. Department of Health and Human Services Offices for Civil Rights. In the legal sense, HIPAA rules only apply to covered entities. However, covered entities and business associates can form contracts to work together. Covered entities are healthcare providers, health plans, or healthcare clearinghouses because they directly deal with patient information. Business associates perform activities that involve the use of protected health information to provide services to the covered entity. Since business associates have access to protected health information and work with that information, it is crucial that they follow HIPAA rules. Examples of business associates include third-party administrators, attorneys whose legal services to a health plan involve access to protected health information, etc. According to the U.S. Department of Health and Human Services, the contract between the covered entity and the business associate must describe the permitted and required uses of protected health information by the business associate. They must provide that the business associate will not use or further disclose the protected health information other than as permitted or required by the contract or as required by law, and they require that the business associate to use appropriate safeguards to prevent a use or disclosure of the protected health information other than as provided for by the contract. The privacy rule is also known as the Standards for Privacy of Individually Identifiable Health Information. HIPAA legislation provides standards on the use and disclosure of protected health information, which applies to health plans, healthcare clearinghouses, and other healthcare providers or covered entities. The privacy rule protects all individually identifiable health information or protected health information, including demographics such as past, present, or future physical or mental health or conditions. The security rule requires covered entities to maintain reasonable and appropriate administrative, technical, and physical safeguards for protecting electronic PHI. Administrative safeguards are comprised of administrative actions, policies, and procedures. Physical safeguards are policies and procedures that protect a covered entity's electronic information systems, buildings, equipment from natural or environmental hazards, as well as unauthorized intrusions or hacks. Technical safeguards are comprised of access controls, audit controls, integrity controls, and an authentication system. The security rule protects the privacy of individuals' health information while allowing technology adaptations. The security rule also applies to the same covered entities as with the privacy rule, however, it focuses on electronic transmission of PHI, creating, receiving, maintaining, or sending, and not to PHI transmitted orally or in writing. Next, we will discuss the breach notification rule. A breach is an improper use or disclosure under the privacy rule that compromises the security and privacy of protected health information. This rule requires covered entities and their associates to provide notification in the event of a breach of unprotected health information, but only if the breach involved unsecured protected health information. Following a breach of unsecured information, the covered entities must then provide the breach notification to affected individuals, the Secretary of the HHS, and in some cases the media. Covered entities must notify and provide an individual with a written notice either by mail or email within 60 days. If the breach in a covered entity affected more than 500 individuals of a geographic area, a covered entity is required to issue notices through media outlets also within 60 days. Covered entities must also report to the Secretary of the HHS on their website by filling out an electronic breach form report. HHS reporting frequency varies depending on the number of individuals affected. Cases with less than 500 affected are required to report on a yearly basis, and those with more than 500 affected are required to report within 60 days. The enforcement rule supplies evidence to compliance and investigations and inflicts civil money penalties for violations of HIPAA. The enforcement rule was proposed on April 18, 2005, for the imposition of civil money penalties and also clarified the investigation process and determination of penalty amounts. The enforcement rule amended the existing rules related to the investigation of noncompliance to make them apply to all of the HIPAA administrative simplification rules rather than only to privacy rules. The enforcement rule came into effect on March 16, 2006. Risks of noncompliance to HIPAA regulations can include the following: liability risks if negligence is found, both civil and criminal; financial risks, both fines and penalties. If the violation is unknowing, the fine could be $100 per violation with an annual max of $25,000 for repeat violations. The violation has a reasonable cause, the fine could be $1,000 per violation with an annual max of $100,000 per repeat violation. If the violation was of willful neglect but corrected within the required time frame, the fine could be $10,000 per violation with an annual max of $250,000 for repeat violations. And then if the violation was of willful neglect and not corrected within the required time frame, the fine could be $50,000 per violation with an annual max of $1.5 million for repeat violations. And lastly, there is a reputation risk for noncompliance that could tarnish the image of your enterprise. Last but not least, it is important to also know about the HITECH Act and the Omnibus Rule. The Health Information Technology for Economic and Clinical Health Act was part of the American Recovery and Reinvestment Act of 2009 and was signed into law on February 17, 2009. The act was used to promote the adoption and meaningful use of health information technology while addressing the privacy and security concerns associated with the electronic transmission of health information. In 2013, provisions to the HITECH Act, referred to as the Omnibus Final Rule, improved patient privacy protections, gave individuals new rights to their health information, as well as strengthened the government's ability to enforce the law. The Omnibus Rule consisted of the following four final rules: modifications to the HIPAA privacy, security, and enforcement rules, changes to the HIPAA enforcement rule to incorporate the increased and tiered civil money penalty structure provided by the HITECH Act, changes to the breach notification for unsecured protected health information under the HITECH Act, and modifications to the HIPAA privacy rule as required by the Genetic Information Non-Discrimination Act to prohibit most health plans from using or disclosing genetic information for underwriting purposes. So what does all this mean? We must take all these rules and regulations and now discuss some key points in developing and implementing an effective HIPAA compliance program. As in any industry, the 7 elements of implementing an effective compliance program include the following: implementing written policies, procedures, and standards of conduct, designating a compliance officer and compliance committee, conducting effective training and education, developing effective lines of communication, conducting internal monitoring and auditing, enforcing standards through well-publicized disciplinary guidelines, and responding promptly to detected offenses and undertaking corrective action. With the added HIPAA rules, regulations, and requirements, it is even more important to ensure that your compliance programs include those specifics. An effective HIPAA compliance program will improve the effectiveness of the security management program, further integrate security and compliance into day-to-day operations, enhance the technical infrastructure, as well as strengthen internal controls and processes. The following 5 steps are especially important when implementing an effective HIPAA compliance program, and we will discuss further. Step 1, designate a compliance officer. Step 2, risk assessment. Step 3, privacy and security policies and procedures. Step 4, business associate agreements. And Step 5, training employees. Step 1, designate a compliance officer. Designating a compliance officer in conjunction with the appropriate authority is critical to the success of the program, including the appointment of a high-level official in the billing company with direct access to the company's governing body, the CEO, all other senior management, and legal counsel. Responsibilities of the compliant officer will depend on the size of the organization, but key functions include coordinating and communication, specifically with regards to planning, implementing, and monitoring activities. They will serve as the point person for all compliance activities. Step 2, risk assessment. This step evaluates your workplace and electronic devices to assess the potential risks and vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information held by the covered entity or business associate. The risk assessment for a HIPAA compliance program should specifically evaluate the following areas: meaningful use status, the HIPAA security law standard, and the National Institute of Standards and Technology Security Controls. The meaningful use status requires entities to protect electronic PHI compliance with the meaningful use core objectives through the implementation of appropriate technical capabilities. The HIPAA security law standard requires entities to be in compliance with the HIPAA security rule through the implementation of security controls, administrative safeguards, physical safeguards, technical safeguards, and organizational safeguards. And the National Institute of Standards and Technology Security Controls include access control, security awareness and training, audit and accountability, certification, accreditation, and security assessment, configuration management, contingency planning, identification and authentication, incident response, maintenance, media protection, physical and environmental, security planning, personal security, risk assessment, system and services acquisition, system and communications, and system and information integrity. Step 3. Privacy and security policies and procedures. It is an essential function of the compliance officer and committee to develop, adopt, strengthen, and implement the required HIPAA privacy and security policies and procedures. HIPAA privacy and security policies and procedures must ensure the privacy of protected health information and the security of such information, including electronic PHI. Policies and procedures need to be reviewed and updated regularly, clearly documented, and communicated with staff. Step 4. Business Associate Agreements. It is first important to know that under HIPAA regulations, persons or entities who have access to your patient's PHI or electronic PHI are considered business associates and should be audited prior to signing agreements. Business associate agreements should also be reviewed regularly in conjunction with the company's risk analysis. Managing business associate agreements should include the following. Identify business associate agreements that create, receive, maintain, and/or transmit PHI or electronic PHI on behalf of your organization. Execute a compliant business associate agreement and implement administrative, physical, and technical safeguards that reasonably and appropriately protect the confidentiality, integrity, and availability of electronic PHI with each agreement. Verify that business associate agreements are compliant with legal and regulatory requirements by performing the following tasks on an annual basis. Determine if the business associate is continuing to perform services governed by the business associate agreement and terminate if applicable. Review each business associate to verify the appropriate level of access to electronic PHI is granted. Conduct a security review of each business associate to confirm compliance with the HIPAA security rule. Step 5. Training employees. HIPAA privacy and security rules require organizations to train and educate employees on their privacy and security policies and procedures as necessary to do their job. Employees should therefore be trained upon hire and at minimum on an annual basis. Whenever there are changes to policies, procedures, or regulations, it must be communicated to employees and education should be provided to ensure full compliance at all times. Training and education should be well documented to include who attended the training, what the training entailed, and how frequently the training occurred. Certain HIPAA violations could lead to civil or criminal penalties for employees who then might receive discipline from the organization, which could then become a case of litigation if the employee wasn't trained. This last step is crucial in an effective HIPAA compliance program. It is in the organization's best interest to invest in the training and education to prevent HIPAA violations or data breaches that could be costly to the organization. As a notable case of HIPAA noncompliance, we reflect on the 2015 case of S Corporation versus the U.S. Department of Health and Human Services Office for Civil Rights. S is an insurance holding company based in San Juan, Puerto Rico. The company provides a variety of insurance products and services through their multiple subsidiaries. In a statement made by S, they announced that they experienced 7 breaches over 5 years, compromising the protected health information of thousands of customers. The factual evidence shows that 2 former S employees accessed restricted areas of the company's database containing protected health information. These former employees then proceeded to download the accessed data onto a CD, which they opened on a computer at their new place of employment. The legal issues stem from the fact that the former employees' login codes and access were not terminated after they left the company, causing the PHI to be breached. Since no safeguards were implemented and a risk assessment program was never put in place, the breaches went unnoticed. S cooperated fully with the HHS's investigation and paid a $3.5 million settlement and worked with the HHS to develop a corrective action plan to resolve the current breach and address any future breach attempts. In conclusion, HIPAA and all of the rules and regulations stemming from it have been a great asset for advancements in technology and keeping up to date with policies. If the former employees of S had followed protocol and proper safeguards were in place regarding access control, S never would have ended up in the position they did. S is a prime example of the necessity of an active and effective compliance program and how non-compliance can be extremely costly to an organization. This concludes our presentation on HIPAA compliance in the insurance industry. Thank you for listening.